Hey, good afternoon, everybody. We put this together. I think our main goal is to try and bring something a little different to the table, right? There's a lot of different discussions around IRA and different things that are happening in related to healthcare. But from our perspective, I think sometimes we only know what happens in the government from what we watch on the news or we read in social media. And I think sometimes what gets lost in the shuffle is that there's different ways that we as advocates, as human beings and as people, because it always comes down to being about people, that we can do different things to try and drive change. And unfortunately, it's not easy. It's often a fight that sometimes we lose before we can win. But ideally, if we don't fight, if we don't put something in front of the table to take care of people and make this world better, especially in this healthcare space, then I think we fail in the jobs that we do. And we're also passionate about it, and we never want to lose the focus on that. So we'll talk a little bit more about that. First, we'll do some introductions, and then we'll kind of talk about the plan for the next few minutes. My name is Randy Odebrowski. I'm the Chief Operating Officer for Good Days. Been with Good Days for 7 years now. Prior to that, worked in pharmacy for Walgreens, every type of pharmacy basically across the country for close to 20 years. So, but whether I'm with my position with Good Days now, and our organization stands for it, it's always about helping people. It's about access, it's about advocacy, it's about assistance, and it's about awareness and trying to make a difference. And it's also personal. All of us are in the healthcare space for a reason. All of us are trying to make a difference for someone every day for a reason, and this can never get lost in the shuffle of that. And whether it's our organization, whether it's us as individuals, while it's helping somebody else that's down in that exhibit hall or someone that we're going to meet here, it's about, again, finding a way to move forward. And typically, we need all of us to come together to make that happen, or it's not going to. Dan?
Thank you, Randy. Technology is not my friend. Appreciate that this is a very high-tech setup. So I think we're all good. I'm going to be advancing slides periodically, but thank you for that introduction. My name is Dane Christensen. For those of you who don't know me, I'm managing partner of the Health and Medicine Council in Washington, D.C. We are a public relations firm. We were founded in 1978, which oddly makes us one of the older Washington representation firms in DC. We primarily work with patient organizations, though we do represent stakeholders from across the healthcare space. We work with about 40 groups right now, and most of those groups that we work with, we've worked with for years, not decades. We work with very large organizations like the American Lung Association, which we've worked with on their advocacy issues since the 80s. We work with very small organizations, and I don't mean small in any term other than the size of the patient community that's affected. Of course, we all have lungs, so the American Lung Association affects many, many, many Americans, but we also work with a number of rare disease organizations like hereditary angioedema, pulmonary hypertension, to advance their priorities. And I know what you're thinking, geez, if you've been around for so long, you've so many different groups, isn't there a lot of conflict? That's what happens in Washington, D.C. It's disagreement, it's all those types of things. And the answer to that is no. Because in the healthcare space, there tends to be more of a confluence of interest than a conflict of interest. Despite what you see in the news or despite how the media portrays things, most folks want the same thing. There's common goals. They want to lower out-of-pocket costs for patients. They want to preserve the physician-patient relationship. They want to make sure patients get innovation and science and better treatments and therapies, cures. So there's usually folks pushing in the same direction. The obstacles tend to be a lack of awareness, a lack of understanding about particularly rare disease conditions, and a little bit of a lack of familiarity with just how things work on Capitol Hill. So we're going to talk through those items today. I am not a lawyer, so this is not going to be, as Randy noted early on, a regulatory discussion or specific things that legally are being debated. This is about what's happening on Capitol Hill, how patient advocates, how their allies make a difference working with policymakers and influencing Congress's role, elected officials' role in shaping policy. There's going to be three common themes that come through. The first is that this is about coalescing around issues of common concern. So how do we work together to make progress and make incremental gains on an annual basis? The second is that you don't have to be an expert in things like regulation to have an impact. There are other organizations, stakeholder groups. This is a perfect example that can provide you with key information. And the third is the importance of making your voice heard. And, we host dozens of Hill Days every year. We have lots of engagement with congressional offices. One of the most common questions we're asked is I am not a patient myself. Can I be an advocate? And the answer to that is of course. I mean, lawmakers know that someone who's personally affected has a pure self-interest. They have a healthcare journey, but many of you in this room are familiar with those journeys as well. You have a perspective too. The patient voice is important, but we often have caregivers, of course, that are advocates. We have allies that are advocates. And we've even had someone who's been as a neighbor of a patient that came to advocate because they knew that their neighbor couldn't be there. They're all sharing their own personal story, though, and they're sharing their perspective with policymakers. So, bit of a long-winded introduction, but I hope one that helps set the table for what we're going to talk about today. And Randy, if there's anything else you'd add before we get into it, please go ahead.
No, I think that the value that Dane brings is he puts it into layman's term, right? I understand as much as government as school taught me, or I read in the news as I alluded to earlier. But when it comes to taking care of patients, you have to understand where you can get involved and where you can make that difference. And it is not only that awareness, but that education. And I can't teach myself. Dane, luckily, he's here to help that happen for our organization and for us in this room and for many other groups. But again, that comes from the heart. So to Dane's point, we're going to focus on kind of the landscape of what's happening in the Congress right now. We're going to talk about some key players. Some of these faces you may see, you may know, some you may not. But how does that affect the landscape that we're in and impacts those people that we want to help? I think why advocacy matters. And from a grassroots level, right? It doesn't have to be big. We're not going to change the whole game overnight, but we can make those differences. And it starts with the passion of the people in this room and at this conference and across the country who are in the healthcare space. And that's important. We'll talk about the appropriations coming up. A lot of people don't understand that dynamic. Dane's educated me very well on that. So that helps out well. And then we'll talk about some different legislation, whether it's active or pending, so that you guys can know what's going on and how you can support it. And then finally, we'll wrap it up with a call to action. How can we get involved? What can we do? How can we do this on an ongoing basis, not just in this room today, but when we go back to our actual lives and work and around patients and people we love, how we can make that difference. Dan?
Thank you, Randy. And if we don't filibuster all of our time, we'll have enough time for questions at the end. There'll be a microphone that can be passed around too. This is one of the recorded sessions, so just an FYI if we get to the Q&A portion at the end, but we're happy to be a resource. And as Randy noted, we're certainly in what's called a dynamic healthcare environment. There's a lot of changes. There's a lot going on. There's probably a lot of sessions about new things that are being implemented. But this is largely what the situation has been post the passage of the Affordable Care Act. So the patient community advocated very strongly for a few hallmark changes to how coverage and access works. No pre-existing condition discrimination, lifetime and annual caps, those things. This is now going back to being almost ancient history over a decade ago, and how the healthcare system has been adapting ever since then. The patient groups would say it's been like whack-a-mole with new issues that are popping up. And many of you have probably seen some of these things as well. We're going to talk about prior authorization. We're going to talk about copay and premium, that type of patient assistance. We're going to talk about step therapy and fail-first protocols. But in addition to figuring out how to solve these problems for one person who needs it, we're also going to tie that back into why not solve that problem nationally or contribute to the efforts to deal with these issues overall. I'm not saying that's the end-all be-all. There could very well be new issues that pop up in the next Congress or next year. But how do we work together to continue to make that incremental progress and to resolve these most disruptive barriers to proper patient care? So right now, just as a little primer, what are we doing? It's the 118th Congress. So we had an election last November. A new Congress came in January. This is the 118th Congress. They're going to be in place for 2 years. There's going to be another election next November. And then the January after that, there'll be some new cast of characters that are coming to town. But as many of you probably know, we have what's called a divided government at the moment. We have a Democratic presidency. We have a Republican-controlled House of Representatives, and we have a democratically controlled Senate. The Senate is a little less relevant because I think, as some folks know, there's a 60-vote majority there that's required, and very rarely does somebody have a 60-vote majority with their party. Now, folks often say, geez, if I watch the news, this seems like a recipe for chaos and disruption and gridlock. Can anything get done? The media is always talking about these most divisive issues, but what we want to underscore is there's a process underneath that. And anything that moves forward is done so on a bipartisan and consensus basis. They do work on these issues year over year. The sensational items might make the headlines, but there's a process underlying that there's a regular legislative effort, and they do make changes and they do work together on those issues where they have consensus. So one example is, of course, no surprises, which some of you might be familiar with. Congress had a big focus on lowering out-of-pocket costs for patients. They said, what are we going to do about this? They had proposals ranging from very progressive to very conservative and everything in between. But they're looking for those areas where they could find something that had consensus support. That settled on surprise medical billing and the No Surprises Act. So even as some of these other issues persist, and I'm not commenting on the No Surprises Act itself, I'm just saying that's how they decided to move forward. They said, we're going to work on out-of-pocket costs. They looked at a variety of things, and that's where they felt like they had enough votes to change the law and move forward. So we're going to put that in context for just a few other things that are going on right now. And of course, if we had elections and we have a new Congress, we have a new cast of characters. For a long time, Congress had been a really static environment. Some members won their seats and they were just members for life. But up till about 8 years ago, we started seeing a lot more turnover on Capitol Hill. Term limits are in place. That might be, and I mean that for committee leadership, not for the country as a whole, but if you're chairing a committee, you might only be able to do that for 6 years and then you have to leave. So if you were the chair, do you want to just go back to being a regular member? So that's fueling it a little bit. But what else is fueling it is voters are active, they're going to the polls, and we're seeing changes. So there's new members getting elected. There's been a lot of turnover, Congress over Congress. So one thing is if you had a member, maybe you knew them, maybe you had a good relationship, it might be somebody new now. So each year for the past 3 cycles, about a quarter of Congress has been replaced. They've been completely new folks. Not familiar with Capitol Hill, important to educate them about these types of issues. But this time in particular, we saw some changes in committee leadership. We have new appropriators, and I'm going to talk about the appropriations process because it is used to make policy. Appropriations bills or spending bills fund the federal government, but they need to be done every year. So it's often a way that they comment on different issues or move things forward. And so we have a new person in appropriations, it's Senator Susan Collins from Maine, who's now a leader for the Republicans. And then in the Senate, we have the Health, Education, Labor, and Pensions Committee. And this is just a microcosm of broader changes that have occurred on key healthcare committees for the 118th Congress. But there's 2 new folks that are running the Health, Education, Labor, and Pensions Committee, which deals with health issues in the Senate. One of them is a familiar face. It's Bernie Sanders, the independent senator from Vermont. Another one is Bill Cassidy, who's a doctor from Louisiana. Bernie Sanders, you probably know, he's very bombastic, he's very political, but when he took over the chairmanship of the Health Committee, he put out a statement saying, I know people know me for my views and for being polarizing, but I get that the process is one about consensus and deal making, and I'm going to do that. I'm going to use my role to come to consensus and find ways forward, not pound on the table and say it has to be my way or no way else. He has a good partner for that in Bill Cassidy, a practical lawmaker from Louisiana, a physician, so has a perspective on some of these issues. And together they're going to try to find those things like the No Surprises Act where they can get enough votes and get things done. So I think it's important to highlight that distinction between politics and policy. There's a lot that goes on in the news and social media that's meant about the elections. Who gets elected? Who's saying what? It's often the most dramatic thing, but underlying that, there's a process that is usually very routine and operates and functions and involves people reaching out to their members of Congress to educate them about these issues. So that process is the one that matters. The education matters, and most of these issues is really what you're trying to overcome is a lack of awareness and familiarity. Do these folks who weren't even in Congress a year ago know what patients are facing and have any ideas about how to solve some of the most pressing problems? We can be a good resource for them in that regard. And there's an important way to think about that, which is Congress has a few key powers that really make them relevant. It's one thing that they're elected every couple of years, which means they're very interested in what their constituents have to say. But they also have what's called the power of the purse. So every year they're deciding how much funding is going to medical research, how much funding is going to CMS, how much funding is going to the FDA, and also what they're attaching to that in terms of policy guidance. Are they doing good work? Are these agencies doing good work for the rare disease community? Are they doing good work for chronic diseases? These types of issues matter to them. They also have oversight of these agencies to go along with sending them that money. They can very quickly tell them what they think they should be working on. And the most important thing is anything they're doing is a member-driven process. It's driven by the legislators. The legislators are driven by their constituents. So making your voice heard and weighing in with advocates is very important. And this is going to be a little bit of Civics 101, so I'm going to go through it very quickly. I don't want to give anyone a flashback to 8th grade, but just so we have a primer, what are some of these key agencies that Congress has oversight of and that we're advocating for? One is the National Institutes of Health, which of course leads biomedical research efforts for the US and the world. Another is the Centers for Disease Control and Prevention, which does surveillance, epidemiology, these types of activities. The Food and Drug Administration, of course, is very involved in deciding which treatments are safe and effective and how they come to market. And then, of course, CMS, the Center for Medicare and Medicaid Service, really sets the tone for coverage, access, out-of-pocket cost, a number of other items. So Congress can have an impact usually on most things that affect a patient's health and wellness. Just one example of common cause coalescing around issues of common concern and making an impact is Chronic Disease Day, which is led by Good Days, but is also a collaboration with these national patient organizations, American Lung, American Liver, American Heart, National Pancreas, about 36 other groups. And that's about focusing on, one, these federal funding for these programs that support chronic disease patients, mainly CDC, the National Center for Chronic Disease Prevention and Health Promotion, and also the legislative and policy issues that are both affecting folks that might have preventable illness, but also conditions that can't be prevented and need to be managed. So everybody working together, whether they're heart, lung, blood, pancreas, really has that multiplier effect and allows a strong and unified voice on the Hill.
I think bringing those groups together, though, again, Good Days, we're talking about Chronic Disease Day, but it could be other groups and other foundations. You don't get anywhere without having a conversation first, right? There's got to be a cause that drives it. We drive Chronic Disease Day, we champion it, and we have, to Dane's point, close to 36 partners behind us. But in the context of those conversations throughout the year, through our events, through these conferences, through things of that nature, it's learning about other causes and other initiatives that are in play, to Dane's point, not just legislative, but that people are championing and getting behind, because you need both large and small groups. Dane talked about some of our national partners, but there's some small local community groups across the country in our own backyard that doesn't have a voice. And if they can't get on board with larger groups to support that cause and to advocate for what they believe in, but more importantly, people, that's really what it's about. So, we look at this slide and we talk about it, but these pictures we put up there kind of show three different pieces. The top one is this year we partnered with Morehouse School of Medicine, historic university, a lot of credibility. They're doing great things, but they're also going to help us move forward and do some things to help the people of the community, and that's what it's about. On the bottom, we have a U.S. Congresswoman. She got an award to reflect a patient of ours who we honor each year, for someone who's championing a cause and trying to make a difference in healthcare across this country. And then on the far right, we have another U.S. Congresswoman, but she's based in Texas. So she's local, she's aware of what's happening not only in our state, but also on a federal level. So you gotta look federally, you gotta look at the state level, and then you gotta figure out how you can bring all those pieces together, again, to keep the momentum going. To Dane's point earlier, you can have conversations and government officials are going to change from time to time. And it's frustrating when you go to DC because sometimes they say, well, if my side doesn't like it, I can't help it even though it's the right thing to do. But you have those conversations and you hope that eventually, people come down the middle and say, we need to help people. And, we were out there in July in DC and it was nice to see for the first time probably in, a couple of years at least, where people are at least opening to being bipartisan and trying to do what's right to help people and move that needle a little bit that we talked about earlier. But again, I think it's a whole effort, and that's something that I want to emphasize. Big or small, we can make a difference. We just got to figure out how to make the connection and have those conversations and come together.
Yeah, thank you. And Chronic Disease Day has very little to do with patient assistance, but it has everything to do with assisting patients. And just an example of that, is, these members of Congress, you talk about something like the National Center for Chronic Disease Prevention and Health Promotion, it has line items for a number of things. It has social determinants of health, which is meant to promote health equity. But that center has been level funded for years. It's level funded for years because it's a member-driven process. The members haven't really understood what they're doing. Why would they increase funding for this? But when everyone comes to Capitol Hill and says, this is why this is so important, research is great, treatments are great, but we need care and support now as well. So if you can support this center and these funding lines, it really provides a lot of resources for the chronic disease community. That even just awareness moves the needle a great deal. And of course, sharing those stories contributes a lot.
Yeah, you talk about constituents to someone in government, they listen a lot more, right? So it's important, again, that we stay active in our community and keep a pulse on not only what our primary missions are, our visions are, but also, again, what's happening around us and what's happening with everyone in this room. Because at the end of the day, to Dane's point, he started off, we all want the same thing. We want to see people in a better spot. We want to help people where we can. And we want to avoid this frustration of the process sometimes because it doesn't need to be there always.
And I'll just really quickly move for some rapid fire issues. I'm sure there's probably other sessions if you want to do a deep dive on any of these. But generally, from a legislative standpoint, there's a few things to highlight that are contemporary right now. One, and this is an evergreen issue, is the FY24 appropriations process. So each year, Congress has to craft a budget. They have to pass it. They're deciding how to fund everything. They fund the FBI, they fund the Department of Agriculture, and they decide how many resources are going to these patient care programs, medical research, the CDC, and this has to happen. If they don't do this, the government shuts down. And even when this has happened in recent years, it usually starts up again, and they ultimately need to come to a consensus. They make these decisions about what to prioritize and what to invest in literally based on the feedback they get from their constituents and from the community. To the extent that people are saying, this is important, chronic diseases are important, rare disease programs are important, their members will respond and they will work to fund those initiatives in these final spending bills. The process starts at the beginning of the year in January, usually doesn't end until December. They say Congress works for crisis or Christmas, which is a nice way of saying at the end of the year they want to get out of town and go home. And that's when you see these spending bills getting passed. But the bills that were crafted with input from the community and from their constituents. Another issue that you might have heard about is step therapy, fail-first protocols, prior authorization. This is important. This is a bill and an effort that's been hanging around for a couple of years now, a couple of Congresses. It's S652 in the current Congress and HR 2630. And I want to point this out for a simple reason. You say, geez, these are kind of no-nonsense issues. Who is against this? The answer is nobody is really against it. The problem is they have limited floor time. They can't pass every bill. HR 2630 means it was the 2,630th bill introduced. In order for this bill to become law, it's got to pass the House, got to pass the Senate, got to be signed by the president. It needs to continue to move up that priority list and get into that must-pass pile. Every member needs to know about it. Every House rep needs to know about it, and they need to feel some pressure to get it done. They're not going to be opposed to the issue itself, but they need to find a way to bring it to the floor, to go through the legislative process, and to pass it. I think folks appreciate this as a consensus measure. It's meant to provide guardrails. It doesn't even ban fail-first therapy. But in order for the bill to pass, it needs to start gaining a critical mass of support. There are 435 House reps. There's 100 senators. Each one of them needs to know why it's important to move this forward. No one member could do it on their own, no matter how strong a connection they have with an affected patient. The next issue, which I know they're doing a session on, is the Help Co-Pays Act. This one has only been around since the last Congress, so you kind of reach a tipping point with these things. There was a bill pre-Affordable Care Act called the Genetic Information Non-Discrimination Act. It had what we would probably think of as common sense requirements. If you wanted to get tested and find out that you have a predisposition for breast cancer or another disease, the results of those tests cannot be used by your employer to fire you because they think you're going to cost more money or to deny you a life insurance policy. This bill took 8 years to pass, 4 Congresses. Congress moves slowly. The government moves slowly. Science and innovation in healthcare often move quickly. The last time Medicare was really updated in a meaningful way was 2003 with the Medicare Modernization Act. So there's lots of innovation that's going on, creating these gaps and issues. Congress needs to know about that so they can change the law. This is a newer issue, but one that should be moving forward as well. This is about making sure anytime someone gets assistance, it's applied to their out-of-pocket maximum, so there's no double dipping, and so they hit those out-of-pocket maximums. But once again, the more it can build support, the quicker that tipping point will come when Congress is thinking about ways to literally pass it. It doesn't have to be 8 years, but it could be. But with unified advocacy, strong outreach, working together, getting to all of those members, it can move forward more quickly. And just as an example of that, the Safe Step Act, which has been around a little bit longer, is now in the mix in some of these PBM reform discussions. They're trying to find a way to move that bill forward. They're literally moving it through the legislative process. But that's the result of a lot of unified advocacy from a lot of strong groups. And then there's another issue with prior authorization, which I'm sure folks are familiar with. The American Medical Association has been leading on this. The bill actually did pass in the 117th. It passed the House, but not the Senate. Even though the House last year was run by the Democrats, the new House is run by Republicans. Kevin McCarthy has already said, when this bill is here, we will pass it again. And that's because of that support, that grassroots support, those grassroots relationships is not a political issue. It's a process question. It doesn't matter if Nancy Pelosi has the gavel or Kevin McCarthy. Because of that groundswell of local constituent support, they're both ready to pass the bill. And I do want to say not every issue is national. You might work with some issues that are very parochial, community specific. There are a lot of community specific bills as well that deal with narrower issues. I'm just going to make a couple of examples. One is the Metastatic Breast Cancer Access to Care Act. This is a bill to fast track disability benefits for folks that have a diagnosis of metastatic breast cancer. Of course, I think folks know the Social Security process, the Medicare process takes years. If you have a stage 4 metastatic cancer, you might not have that much time. It doesn't make sense that the law doesn't allow you to fast track and go right on to your federal benefits. This would change that, but it's just for metastatic cancer patients. They made a similar change for, I believe it was ALS in the last Congress, but these are community-specific changes. And the newer one is the Treat and Reduce Obesity Act. How the government handles these new therapies that are coming online for weight loss and related issues, a little bit outdated. TROA, as it's known, is meant to deal with some of those items, improve coverage and access for the communities, diabetes and others that are seeking to access them. So not every issue is national, some are community specific, but there's always a chance to contribute and help, which brings us to taking action. So I'll mention really quickly, there's a lot of different resources in this regard. You don't have to, ask me what's going on every day in Washington, D.C. If you just sign up for updates from the American Heart Association or the American Lung Association or the infusion nurses or a number of other groups, which I'm sure you're familiar with, these trade associations and 501c3s have this information for you. Part of not being an expert on civics and government, they will let you know when is the appropriations process, when can I weigh in with my member, when is my voice most impactful. But participate, make your voice heard. The key thing is education. They probably are not familiar. They certainly don't have your perspective. They can make these decisions with your input or without it. We certainly would prefer that they'd make them with your input. They're trying to get to a good result, and it can be a multiplying megaphone for the patient communities that are most affected. Just because you don't have a specific condition doesn't mean you're not familiar with the gaps and challenges that patients with that condition face. So please, look for ways and be a resource. Advocacy can be a two-way street. Your office might recognize you as an expert on this and reach out to you to know what to do or how to help. You can provide them with tangible input as they try to make good policy. And I think, Randy, you've probably experienced this firsthand with some of the offices you've met with in Texas and across the country.
Well, I mean, even in this conference alone, Dana and I were talking before we started today. Each time we've left this conference, our organization, us personally, with a new contact and a new person that's an expert in a new area for us. And then how can we collaborate together? It's asking a question. And again, you got to have that conversation, right? And you don't know until you know sometimes, right? From our assistant standpoint, people say, well, good days, I don't know anything about you guys. We've been in business for 20 years, right? But because until you get sick and you need help, you often don't know that something's out there. You ignore it, you're not asking the questions. When we're in this forum with each other, and I don't mean to be preachy to you guys, please don't take it that way, but we can make a difference, to Dane's point. And the key is, again, how do we build this up? Melissa and EJ do a great job doing that. You see them on LinkedIn all the time, right? That's what it's about. But again, if we don't ask those questions or have those conversations, that's where it starts. And then we can come together and make a difference and have partnerships that can continue to build and create that momentum to drive that change. To Dane's point, it takes a long time, and it's frustrating. It's frustrating a lot. I remember when I started, I was talking to Clinda, our CEO, and she says, Randy, sometimes you gotta use hearing no and taking a loss sometimes, right? But again, it's the right thing to do for what we want to see happen and how we make those change eventually come into place in some way, shape, or form.
Absolutely. And it really, some of those opportunities emerge just by being in the right place at the right time. I think it was Mark Twain, an often used quote, just showing up is, the main part of being successful. I'm going to go back to that Chronic Disease Day event. There were a number of great patient advocates there, all talking about their specific challenges. A number of members of Congress, too, one of which was Beth Van Dyne, Congresswoman from Texas, who's on the Ways and Means Committee. Is not unusual after hearing those patient stories, talking about your own journey, talking about some of the major challenges you faced or surprises you encountered, for someone like a Congresswoman Van Dyne to walk up, regardless of their politics, regardless of what you may think of them from what you've seen on the news, just on a human level, and say, hey, I would love to know more about what these advocates are talking about. I want to figure out a way to work with my colleagues to fix this problem. It's really that simple, which brings us to some tips for effective advocacy. Once again, it's important to stay informed and receive updates. And I don't mean watch CNN or MSNBC or anything else. They're going to focus on the most dramatic issues. I mentioned the Affordable Care Act earlier. Some of you know it as Obamacare. Of course, that was not a standard legislative process. That was not consensus. That was one party, had a majority and said, this is what's going to happen. But I remember when the Ways and Means Committee was hearing that bill, of course, they debated it, they hotly talked about it, and then they voted on a party line to move it forward. And the news that night was all about division, pros, cons, all that stuff. There was an afternoon session, though, for that hearing, too, where they looked at another set of Medicare bills. Each one of those bills, if I recall correctly, went through committee unanimously. Not one of them made a headline or was on the news. So the process works. There's going to be a skew nationally towards these most dramatic items, but don't lose heart. Simply educating members about these other issues, using your voice to make a difference, asking them to weigh in, does have an impact and works the political process to get these things moving closer and closer to becoming a law. Groups like American Cancer Society, groups like a number of professional organizations have great resources to provide updates just on those community-specific or national coverage and access issues that you might be interested in, and can even send out things like Action Alert that tell you when you can participate or do a Hill Day, or even something on the state level locally that might be impactful too. Take action when you're prompted. Don't miss a chance to educate or raise awareness. That's the key thing. Remember, even if these members are on a healthcare committee, it doesn't mean they're experts on healthcare. Bill Cassidy is a doctor, but there's only about 20 members of Congress that can say that. Most of them were car salesmen. Most of them were lawyers. A lot of them have staffers that might be working on healthcare issues, but they probably came from the campaign or just graduated from college. They need your input to help them make good policy. They want you to come to their office. They want to hear what you have to say, and they want to figure out solutions. And once again, this is all about policy and the process, not politics. Those offices that you're talking to, those staff that you're talking to, don't have anything to do with the campaign. They don't have anything to do with tweets that are going out or anything like that. This is just about educating them about what's going on with the community, telling them how to make a difference. And everyone should have the expectation that if you've made a reasonable request and that you followed up, they're going to look for a way to respond to you in the affirmative.
Yeah, definitely. Again, I'll use an example. We're a member of our Chamber of Commerce. We're from Frisco, Texas, north of Dallas. And we recently went to a Capitol Hill Day in Austin, it's our state capital. And they had a whole agenda, and nothing was really healthcare related, patient-based, anything related to access assistance, all those things I talked about earlier. And, we kind of looked and said, something's wrong here. But number one, we got to be educated on what's on their list, right? So if we're going to be part of something, we got to understand it too, practice what we preach. But in the context of that, it allows you to create these relationships and these connections where you can get in front of these people and have those one-on-one conversations, or get in front of a room like we are right now and do your part to educate, right? So we learned a lot during that process, but that's one example where, you know, being a member of the Chamber of Commerce on our day-to-day, it may not do a lot for us. But in the context of that, it allows us to get to Austin, talk about, you know, what we're passionate about, what we want to make a change in, and it made a difference. And, you know, that ideally leads to follow-up meetings, follow-up discussions, extended relationships that we can build on. And again, to Dane's point, we say some of the same things multiple times here, but you got to keep doing it. You got to keep doing it. You got to have those conversations. You got to educate. I always ask Dane and Jim, who we work with, well, where do you guys find this information? How can I stay on top of things? Because we all get way too many emails every day. There's so many different news outlets, social media, everything else. Like, who's credible? Who's going to tell me really what we need to know? And who can do it in like 10 minutes? Because that's all I'm going to give it, because I won't keep attention long. And it's again, talking to your colleagues, talking to each other, and finding those quick, credible resources and solutions to understand things better, and then try and apply it to your life. And then, again, figure out, hey, we're part of coalitions. We talked about our Chronic Disease Alliance. We're also part of other coalitions as well. And in some cases, we're there and listening just to be educated. And then if they need us to stand up or we can contribute, we want to do that. But in the context of that, again, so much of it is number one, getting that awareness, being educated on it, and then figuring out how we can apply it and contribute to making a difference as a whole. You know, business is very competitive, right? Everyone wants to do their best thing. Everyone wants to keep their job. Everyone wants to make their pay. But at the end of the day, and when it comes down to people, we got to stop being so damn competitive, right? We got to figure out, okay, there's enough for all of us, but if we all came together, we still wouldn't have the solutions that we need. So I think we got to remember that piece and realize that when we do things, sometimes it's not for immediate profit for us. It's not immediate gain for us or organization, but it's something that we stand for and we're committed to, and we want to see the difference happen moving forward.
Thank you. And we did not waste all of our time, so we can answer some questions, but I do want to close by bringing this back to one point. We did talk a lot about that national impact, but many congressional offices can also be a resource on some of those specific issues as well. Every congressional office has local offices. They have DC offices, which we're talking about with these policy conversations, but they also have local offices. You've probably seen them when you're driving by a local strip mall and it says Congresswoman so-and-so on the front. That's their local office. Those offices tend to be filled with what they call constituent service staff. They are there to help the people from that district or state. If someone is having a problem with their VA benefits, somebody's Medicare had an issue, contacting that office and telling the staff about it not only helps identify these policy issues, but they might be able to fix that problem too. Some insurance company gets a letter from a member of Congress saying, I don't think you treated this patient very well, or I think that there's a misunderstanding here. You might get fixed pretty quickly. So I do want to make the loop that they can be a resource on some of those specific items, but it tends to be the constituent service staff that are for the patient's member themselves. And particularly with federal programs, Medicare, Medicaid, VA, TRICARE, they have a lot of influence to figure out and get to the bottom of how to help this person who might be experiencing a specific gap. So thank you once again, everyone. I think there's been a couple of people poking in for the room, but thank you so much.